Hi, I'm Dr. Melko. In our practice, we offer same-day crowns. Our patients love same-day crowns because it saves them a lot of time. It saves them an additional visit. They're very precise to make. They also love the technology associated with it. They enjoy watching their crown being designed by myself, the software and the scanner, and then many of them are eager to watch the step when we start fabricating in the milling machine, basically, and as we glaze the crown. I love it. Patients love it because it saves time and it's precise and accurate. Same day crowns can definitely be done in one visit. That's what we do in our practice all the time, actually. The patient receives the crown bonded in his mouth at the end of the visit. How they work, it starts the same way. We remove the cavity. The patient is numb, comfortable, relaxed, and then we start removing the cavity, build up any compromised tooth structure, and then I start designing really the tooth in that specific design where it can receive the crown. We take a digital scan of the tooth that is connected to the CEREC machine, to the same day crown machine. That scanner will enable me to design the crown from scratch. The edges of the crown, lines of the crown, the margins of the crown, profile of the crown. I can also control the basically color of the crown, what type of exact shape that will match the patient's teeth color. And then we basically send it to the milling machine that's in-house, that's in the practice basically. Starts milling the crown from a block. And then there is a second machine that glazes the crown, beautify it, adds the final aesthetic touches to it. After that, we go ahead and start trying the crown in the patient's mouth, just like the traditional way of bonding the crowns. And after we ensure that the patient is happy with the look and the bite is adjusted and comfortable, we go ahead and bond the crown permanently and just follow up instructions how to care for the area and how to care for the crown. The same-day crown can fix common dental problems like a large old filling that has decay underneath it again. A large old filling that it's breaking down and it's not healthy to leave it in the mouth anymore. A patient who calls with the same-day emergency actually with a tooth that just broke and the fracture is big where actually it needs to be restored by a crown versus a filling. It can also resolve a problem that if the tooth needed a root canal and the tooth is pretty compromised, so it needs to be covered by a full restoration. So same-day crown will be a very efficient solution for teeth, for compromised teeth with root canals. The material of same-day crown is definitely as strong. It is actually the same that what is used by the lab. And nowadays, again, referencing back to the technology that we use in our practice at Melko Dental, we have these materials and blocks where we can actually, the same materials used by the lab, whether it's Emax, whether it's zirconia, whether it's Catania, it all can be manufactured and be done in-house in our practice. So it's definitely as strong, as reliable, as long-lasting and aesthetic. We make sure that the crown is fitting perfectly and precisely by actually testing the crowns from all angles, corners, margins. We're checking for precise fit with the right tool to be utilized in that case. We actually take a digital image, an X-ray, to verify the precise fit of the crown. And then the third component of that is we actually floss in between the new crown before we bond it, and we check the bite as well and adjust the bite if the bite needs to be adjusted. And also taking verbal feedback constantly from the patient during the process. We want to make sure when we're flossing, he feels comfortable, it's not tight, it's not painful. We want to make sure when he's biting, he's feeling comfortable, it doesn't feel like it's tall. And all of that, it's adjustable and part of the bonding and seating process of the crown. One of the great benefits that patients love about same-day crowns is really having the crown done and bonded at the end of the appointment. Like at the end of, an hour and a half, they're receiving their crown. That basically saves them time and gives them the reassurance that they're walking out with a permanent crown cemented. All what they need to do is to brush and floss. They're not dealing with a temporary restoration, temporary crown, and temporary crown falling. So they love it because it's practical and it provides the permanent solution the same day. In certain cases, the tooth presents a challenge. For example, if the tooth has broken deep down to the gum line, where the margin or the fracture area is very deep underneath the gum, and most of the time we see a lot of bleeding in this case. So the software scanner might not present best accurate solution to basically record that picture and make the crown in-house. And in the rare cases, this happens where I tell the patient it's probably better to take actually a physical mold, a physical impression versus a digital scan and make it and we send it to the lab. However, I would like to make the remark that technology and the advancement in same-day crown machines, it's making this less and less of the case because they're very precise nowadays. And once we as experienced clinicians can stop the bleeding, they can record the picture and a crown can be accurately made. If you are ready to start on the same day crown, and if you want to inquire about it, please give us a call at 408-720-1123, or you can visit our website at Melco Dental and schedule your appointment online as well.